Let's bring you updates on the outbreak of cholera in Nigeria and efforts to curb further spread. The Nigeria Center for Disease Control and Prevention has placed the country at high risk after conducting an assessment in response to the increasing cases. So far, 1,528 suspected cases and 53 deaths have been recorded across 31 states and 107 local government areas, and it's with a case fatality rate of 3.5% since the beginning of the year.
As of the 24th of June 2024, a total number of 1,528 suspected cases and 53 deaths have been recorded across 31 states, 107 local governments, with a case fatality rate of 3.5% since the beginning of the year. 3.5% is the average now, and the national expected average is just 1%. So we find these fatalities as not just statistics, but a significant loss of loved family members, spouses, and parents, and often a seasoned healthcare worker and team member. This situation is likely to be compounded as the rainy season intensifies. If you or anyone you know experience sudden watery diarrhea, please do not self-medicate. Visit a healthcare facility immediately. To our health workers, we urge them to always practice standard safety precautions, which include wearing gloves while handling patients or providing care to an ill patient or relative, and intensify surveillance efforts to promptly report suspected cholera cases to the various health departments.
In Oyo State, the Seyi Makinde-led government has announced that it has identified 7 suspected cases in the state. Commissioner for Health, Oluwaserimi Ajetumobi, addressed journalists in Ibadan, the Oyo State capital.
Nigeria is currently experiencing cholera outbreak, with the Nigeria Center for Disease Control and Prevention reporting over 1,528 suspected cases in 31 states. The main cause of the outbreak has been linked to contaminated water and poor sanitation, made worse by the rainy season, which can spread the disease through flooding and unsafe water sources. Following this development, Oyo State government says it has identified some suspected cases and they are under observation. The ministry also adds that it has implemented measures to contain the outbreak and prevent further spread.
So far, so good. God has blessed us in Oyo State. I told you before that before now, we have started preparing for this kind of emergency preparedness. And so far, so good. We have 7 suspected cases in Oyo State as at this morning. And out of these 7 suspected cases, 5 had been declared negative. We are awaiting the culture of 2 other suspects. As I'm talking to you, we don't have any positive case of cholera.
Regarding the ongoing strike by the health workers in Oyo State, the commissioner assured that Governor Makinde is actively working to address the workers' demands and resolve the issue.
But it's just to tell you that before now, even before they declared their strike, the governor, the executive governor of Oyo State, Engineer Seyi Makinde, has tried his possible best to make sure that he puts might on the faces of workers. The salary is not being denied, but it's just that they want an increase. And part of this increase, everything has to be on deck because, just as you know now, the nurses are on strike too, and they are coming on strike. They cannot do for a part and neglect the other. Everything has to be taken together so that, because if you do for a part and neglect the other, it's a vicious cycle. Other two will come and they say they are going on strike then. So he's trying his possible effort to make sure that everybody is happy.
The Oyo State government's move to contain the cholera outbreak and end the health workers' strike in the state is a major move towards ensuring that normalcy is maintained in the state health sector. Olaide Oyewole, TVC News, Ibadan.
The numbers are increasing daily. What are the measures to containing the spread? Former Director of Disease Control, Lagos State Ministry of Health, Dr. Eniola Enriosho, joins me on the program. Good to have you join us on the program, Doctor.
Good evening, madam.
All right, with about...
Pleasure being with you.
All right, good to have you join us. Well, with 1,528 suspected cases of cholera and, of course, 53 deaths recorded this year alone, the NCDC on Monday placed Nigeria at high risk of the disease. How worried are you about this, especially considering that schools are in session and the rainy season is just starting out?
Well, thank you very much. Well, one, naturally, we worried that we are having this high number of cases in the country. At least in the last over 5 years now, we've not had such high number of cholera cases in the country. So, but one good thing is that the NCDC and the states that are affected, especially Lagos State, actually on top of the game. They are putting a lot of measures to ensure that this cholera case is abated and it is contained immediately. I know, for instance, NCDC, as stated by the NCDC DG, they have activated the Cholera Emergency Operations Center, and they have also intensified this communication. They have intensified awareness creation, and we are having massive investigation of the epidemic in all the states that are affected. We are trying to identify the sources of infection, and we are also providing information to the public on how to identify cases and how to report at the health facilities and how they are going to be managed. For instance, I know that in Lagos State, all the public health facilities have been put on alert, and the treatment and management of the cholera is free of charge. So if anybody has any signs or symptoms like vomiting and watery stool, just walk into the nearest health center, and you can be rest assured that you'll be attended to. Again, a lot of information has been put into the public just for them to be aware of what we need to do. Then I did mention about risk communication and creation of awareness. A lot of jingles have gone out, and we are still having the jingles in both the print and the electronic media. So the way it is now, I can foresee that in the next 2 weeks, the cholera outbreak is contained, and one can only advise people to take necessary precautions.
We'll talk about those. Yes, Doctor, we'll talk about those precautions, and maybe we should just get to it quickly. What precautionary measures should people take? And before that, what symptoms really should people notice that would make them present themselves at a health facility?
Okay, well, the most common symptom of cholera is this watery stool, profuse watery stool, diarrhea. We call it rice water stool, because the stool is not really formed. It's like a rice in water that you are cooking rice in water. That's the way the stool appears. It's very watery and profuse. And some people can also vomit. Along the line, they can go into shock, they can collapse, they can faint, because as you are passing the stool, you are getting dehydrated. So by the time you get to the stage of severe dehydration, the person can faint and collapse. And that is why we are saying that you need to take a lot of measures. Once you observe this, the first thing to do is to get ORS, that's oral radiation salt, from a nearby chemist, and prepare that one. That's the common salt that we use for children when they have diarrhea. So it is important that people know of this, and they have to report immediately to their facility, just to ensure that they are properly treated. If you take note that most of the cases, if you take note that most of the cases, most of the deaths that we have are due to late presentation at the health facilities. People have they have gone into coma, they have collapsed, and most of them have even died before getting to the hospital. So we have a lot of rotten deaths among the number of deaths that we have recorded. So if you are able to get to the hospital, I can assure you that they'll be properly managed and they will recover from the treatment. So these are the symptoms that we expect. Anybody that is vomiting and passing watery stool, that is profuse, all right, then you know that something is wrong, so you have to rush to the hospital.
So no Okay, so no self-medication. But then, is cholera contagious? Can it be transferred from one human to another?
Yes, cholera is, well, the first thing is that about the self-medication, I did mention oral radiation salt, that they can get it and prepare it quickly, just as a kind of first aid measure before they get to the hospital. Yeah, the type that has been detected in the country, the subtype O1, is highly contagious. That means you can easily get it. It's not something that you get through contact, no. You get it through water, contaminated food, and also flies can also pick the bacteria from feces and move it to food if the food or the water is not covered. So these are the things that we are saying that people should avoid. And again, buying all these drinks that we have outside from unregistered and unlicensed practitioners can also spread the cholera epidemic. So what we are saying is that if you are going to eat any food, make sure that you use clean water to cook the food and ensure that there is no open defecation in the environment. That's another source of spread of the cholera epidemic. And again, you know, we are in the rainy season now where we have flooding. So those that are using well as their source of water, the well must be well covered. If not, you can have seepage of feces being moved around by flood, and this can contaminate the well water. So this too can be a source of spread of the infection, apart from consuming contaminated food. So these are some of the ways that cholera is spread in the community.
All right, Dr.
And
Rish.
again, we know that the cholera bacteria, that is Vibrio cholera, has a natural habitat in seafood, especially crabs, crayfish, and also shrimps. So anyone that is eating seafood, you have to ensure that they are properly cooked because they are a main source of spread of cholera.
All right, Dr. Rinshu, let's take a moment. I know you have a lot to say about this, and we'll definitely have time for it. So let's take a moment. When we come back, we'll continue as we explore this topic of cholera outbreak in Nigeria and how we can prevent further spread of the disease. Please stay with us. You're watching the program Beyond 100 Days, and I've been speaking with Dr. Eniola Rinshu, who is former director of disease control, the Lagos State Ministry of Health. Doctor, thank you so much for staying with us.
Thank you.
All right, so 107 local government areas in Nigeria are affected in 31 states, really, in the country. They've reported suspected cases. And we know, doctor, that there are vaccines for cholera. Do you think we are at the stage where we should call for these vaccines?
Well, we have vaccines for cholera, and the vaccines are effective. But as of now, the national program has not introduced cholera vaccine as part of the routine immunization. So what we have at the moment is that the government is not deploying cholera vaccine as it is now. But we have cholera vaccines available in private facilities. That's at the cost. So the government will have to look at the various parameters and see whether there is need to now introduce cholera vaccination for this epidemic and also as part of the national routine immunization for children. But as it is now, it is not one of the measures that the government is implementing to control the current epidemic. So what the government is doing, I've mentioned some of them. So both the NCDC and the states that are affected and the states that are affected have actually activated their emergency operation centers for cholera. So that is where decisions are taken at the national level and at the state level.
Indeed.
Also, as it is now, we have active case search that is ongoing at the national level and also at the state level. I've mentioned risk communication. So cholera is not one of the strategies for now.
You mean vaccine is not one of the strategies? Doctor, you meant vaccine is not one of the strategies for now. All right.
Cholera vaccine is not one of the strategies for now.
Okay.
So the ones we are doing, they are raising awareness. The government is raising awareness.
So it's like preventive measures. That's what government is focusing on at the moment. And if anyone has the
Exactly.
symptoms already, they can go to the hospital and they will be treated.
Yes, free of charge at the
All
public
right.
facilities.
All right. On the news on Monday, we had the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris. Let's bring you some bit of what he said about government efforts at curtailing further spread of cholera in Nigeria.
The country now should be placed at high risk. There are 4 levels of risk. You have low, medium, high, and very high. It suggested that we should activate the Incident Operation Center, National Operation Center for Cholera, so that we can effectively address this situation. The reason being that, having considered all the data available, there is still an increasing trend of suspected cases nationwide. We've seen more cases now in more states than we did in last year. The case fatality rate of cholera this year is about 3.5%, which is much higher than the recommended regional 1% for Nigeria. Cholera has to do with access to water, hygiene, personal hygiene, environmental hygiene, and environmental sanitation. And they suggested activation of this EOC, which we did this morning. We've appointed an incident manager who will coordinate all activities and work with different pillars drawn from different states. The cholera situation in the country now should be placed at high risk. There are 4 levels of risk. You have low, medium, high, and very high. It suggested that
Director General of the NCDC, Dr. Jide Idris, speaking on TVC News there. And Dr. Rinshaw, he talked about the fact that we're at high risk and the fatality rate is 3.5%. That's way more than the 1% that is, do I call it a plan now for the region, Nigeria? What do we do? How disturbed are you about that? And what can we do?
Well, that is it's something that is disheartening, that we have that high number of case fatality, which actually means the percentage of those that have died from the infection. So out of the 1,528 cases that we have in the country, so we have 53 deaths. That is how we came about the 3.5% case fatality rate. So that means this epidemic that we are having is highly contagious and virulent, and that means it's resulting in severe diseases. If not for that fact, we will not be having this high number of cases. So, but all hands are on deck, just like the NCDC DG mentioned, that they have activated the Emergency Operations Center. So from there, they are doing active case search.
All right.
They are also conducting active surveillance, and the surveillance is around water sources, food vendor, beverages, vendors, and all areas that are known that could be the sources of cholera transmission.
I hear you, Doctor. Okay, so these are some of the measures. Now, I'm wondering what you think schools should do at this time. Schools are in session, and students have actually just resumed, after the holidays. But then, thankfully, we do not have any cases just yet from schools, any fatalities or reported cases. What is your advice to schools about containing the further spread of the disease?
Okay, the advice to school will be part of the general advice to the public. So, and the first thing is to ensure that there's availability of clean water. That is very crucial. That any water that we are going to drink must be very clean. It could be pipe-borne water, or filtered water, or water that is boiled, or that is chlorinated officially. So that is the most important thing, to ensure that we have clean water. Then the next thing is that our students, teachers, and everybody must maintain good personal hygiene and environmental hygiene. It's very important, environmental sanitation. Then again, we have to ensure safe disposal of sewage and refuse in schools and also in our various communities. This is very important because flies can move the Vibrio cholera bacteria from feces and deposit them in our water and in foods. So that is why it is important that we have safe disposal of feces, sewage. There should be no open defecation within schools or outside the school premises, and also in our environment. This is an important aspect of it. Then the other one is that we should inculcate the habit of regular hand wash. That's washing of hands with soap and clean water. The water we are going to use for washing the hands will be clean. And this hand washing should take place regularly, and especially after going to convenience toilets, and also before eating and after eating. And those that are preparing food too, they have to ensure that they wash their hands on a regular basis. And before they start preparing food, I disadvise that occasionally some food vendors might need to put on gloves so that they will not be handling food anyhow. Then the other thing that we need to do is to ensure that the foods are properly cooked.
Foods are properly cooked. So based on what you've said, Doctor, everyone has a role to play. Whether you're buying or you're cooking yourself, you have a role to play. Keep your hands clean, continuously washed, and just ensure that we maintain personal hygiene. I must sincerely appreciate you for talking to us on the program. Dr. Eniola Irinsho is former Director of Disease Control, Lagos State Ministry of Health. Thank you very much for sharing with us on the program.
Thank you very much. My pleasure. Well done.